USMLE style question. A 72-year-old man with a history of hypertension, hyperlipidemia, and type 2 diabetes mellitus presents with sudden, painless vision loss in the right eye. Fundoscopic examination reveals dilated, tortuous retinal veins, widespread retinal hemorrhages, and macular edema. Fluorescein angiography demonstrates areas of delayed venous filling and vascular leakage. Which of the following is the most likely underlying pathophysiologic mechanism in this patient? A. Embolism from the carotid artery. B. Thrombosis in the central retinal vein at the lamina cribrosa. C. Occlusion of a branch retinal vein at an arteriovenous crossing. D. Retinal artery thrombosis due to vasculitis. E. Optic nerve ischemia from giant cell arteritis. Answer and explanation. Correct answer, B. Thrombosis in the central retinal vein at the lamina cribrosa. The patient's presentation is consistent with central retinal vein occlusion, CRVO, characterized by sudden, painless monocular vision loss with blood and thunder fundoscopic findings, retinal hemorrhages, dilated tortuous veins, and macular edema. CRVO occurs due to primary thrombosis in the central retinal vein, often at the lamina cribrosa, where the vein is mechanically compressed by the stiff scleral tissue. Risk factors include hypertension, diabetes, hyperlipidemia, and hypercoagulability. Incorrect choices. A. Embolism from the carotid artery, more likely to cause a retinal artery occlusion, presenting with a cherry red spot at the macula and a pale retina. C. Occlusion of a branch retinal vein at an arteriovenous crossing, seen in branch retinal vein occlusion, BRO, which results from secondary thrombosis due to compression by a sclerotic arteriole. D. Retinal artery thrombosis due to vasculitis, could be seen in conditions like giant cell arteritis, GCA, but typically presents with arterial occlusion, not venous occlusion. E. Optic nerve ischemia from giant cell arteritis, causes anterior ischemic optic neuropathy, leading to pale optic disc swelling rather than widespread retinal hemorrhages. Would you like another variation